Contrast-induced acute kidney injury is a complication when doctors use contrast dye, which helps them see blood vessels on x-rays more clearly, when that dye injures the kidneys. Contrast-induced acute kidney injury is important because as doctors are working to try to improve other areas in the body, including the heart and blood vessels, the contrast damages the kidneys as a side effect, and this damage to the kidneys can later translate into very serious outcomes, including ending up on dialysis or even death. It's recently been discovered that when contrast damages tissues, particularly the kidney cells release tiny amounts of catalytic or free iron. This free iron then provides the basis for biochemical reactions that cause further damage to the cells and tissues. So catalytic iron is very important because new drugs are being developed to bind catalytic iron and reduce the rates of organ damage. The role of catalytic iron and oxidative stress in cardiovascular disease is enormously important. We believe that not only in the heart, the kidneys, brain, and potentially other vital organs, as there is a chronic as well as acute episodes of injury, oftentimes due to a lack of blood flow or a toxic agent being administered to an individual, that once cells release catalytic iron, the catalytic iron then fuels oxidative stress reactions and the generation of the dangerous hydrogen peroxide and hydroxyl radical. Those entities then cause cell-to-cell death, much like one would see the development of a brown area in a bruised apple. Unfortunately, there are no approved therapies to prevent acute contrast-induced kidney injury. However, in 2010, it's been a landmark year where I have started as a principal investigator a prospective randomized trial of a definitive new agent, deferoprone, which is a catalytic iron or free iron chelator in the prevention of contrast-induced acute kidney injury. I believe this trial will be a landmark trial in that it's the first attempt with a drug that is currently under the scrutiny of the FDA to reduce the rates of injury to the kidneys and hopefully translate into improved outcomes for patients.